because we're running short of time, we'll rapidly follow that up with Dr. AKSHAY NAIR, who's going to speak to us about the ICO examinations and fellowships, which are a very popular choice across the country. So over to you, AKSHAY.
Thank you. So I'll be speaking about ICO examinations and fellowships. So firstly, when we talk about the ICO exams, why do residents and fellows want to do the ICO examination? So at the end of the day, it's an assessment exam that tells you how good or bad you are. And it is a form of recognition amongst your peers and as well as your patients. In some cases, clearing an ICO exam may improve your chances of better job opportunities. And some of us, like Devendra, I know, take extreme joy in appearing for an examination. And also we love these 4-letter words after our names, additional degrees. So that's another reason to give the ICO examination. A big reason for why you should think of the ICO examination is that it has a reciprocity with the FRCS. In fact, they have really simplified it now, which means that if you have cleared your basic sciences, refraction, optics refraction, and clinical sciences or clinical ophthalmology, which is your either the clinical sciences or the advanced, you are exempt from any of the MCQ papers that they have for FRCS Glasgow. You directly can appear for the structured oral examination, which is very good because that's, in addition to saving a lot of effort and studying, also saves you a lot of money. What about the ICO fellowships? There are different ICO fellowships available. There are 3-month fellowships, there are 6-month fellowships, and there are 1-year fellowships. Now, if you look at the ICO website, it clearly tells you that it is recommended that you sit for the ICO examinations and clear them before actually applying for an ICO fellowship. Although, technically it is possible to get a fellowship without having cleared the examinations. So, what are the pros and cons? You get an additional degree that you can write after your name. It could also get you better job opportunities if you're, the place where you're being employed is very keen that you have an ICO qualification. Also, it helps you in easing out the pathways for navigating FRCS that we send. But unlike, say, an MRC off or an FRC off, it does not allow you to practice in any additional country. ICO fellowships can be done even technically without having to appear for the examinations. At the end of the day, appearing for each of these papers is an expensive affair. So how do the exams pan out? The part A is called the visual sciences examination. It's an entry-level examination which is recommended that you take it during residency. It has 120 questions and MCQ option. These are just subjects that you see on screen are the ones that will be based on which questions will be asked. Your part B is optics and refraction, which has 60 questions again over 1.5 hours. Remember, part A and part B are always together, and you have to individually get passing marks in both to be able to progress to the basic sciences examination. In case you do not clear the optics and the refraction, then you have to take it separately and clear it to be able to give the next part, which is part C or clinical sciences. The best time to take this is just after residency. So the best time to take it just after residency or during fellowship, because you've just cleared all your theory exams and your idea of your theoretical knowledge is extremely good. The next, they have introduced a new type of examination which is called the subspecialty examination. They have 7 different specialties, which is cornea, glaucoma, retina, plastics, neuro-ophthalmology, pediatrics, uveitis, and cataract is included is a part of each of these subspecialties. However, to be able to appear for this examination, you should have at least 1 year's clinical experience, which means you should be in practice for a year. The exam is a 2-hour long exam with 80 questions in it. The examination fees can be extremely expensive. All examinations combined is almost 1.75 lakhs. So how do you prepare for the examinations? So these are the 4 recommended books. You've got Clinical Optics by Elkington, The Theory on Practice of Optics and Refraction by Khurana, John Ferris, which is the gold standard for MCQs for the ICO exam, and the Forrester for Basic Sciences. Also, the Massachusetts INR Infirmary Review and Kansky. If you've read them cover to cover during your residency, rest assured during your basics and advanced examination, you will clear them. Sometimes for John Ferris, which is the MCQ book, questions are taken from the book verbatim without even changing the order of words or the orders of options in the MCQ book in your examination. So if you've really read that well and revised it a couple of times, you'd possibly find the questions easily. So we'll go to quickly fellowships, which are, what are the different types of fellowships? You have 3-month fellowships, which can be in uveitis, ocular oncology, glaucoma, retina fellowships. You also have 1-year fellowships, which can be ocular oncology or retina fellowships. There are about 60 to 90 such 3-month fellowships awarded. It gives you a $6,000 scholarship, which can include your travel and your stay. The caveat is that you have to be under 40 years of age to be able to be eligible for this. It has a very transparent process on ICOPH.org. You select your fellowship, apply for eligibility. Once they check your documents and let you know that you're eligible, you can choose where you want to go. However, based on your application, if you're rejected, you cannot apply again, which is why you need to apply and make sure that your application is completely solid. What is a good time to do your fellowship? Ideally, after having done a fellowship in India, you should go for an ICO fellowship so that you can build on what you can write, on what you've learned. Questions that are typically asked in your fellowship form is, what will you do with the knowledge and skills that you acquire? What skills and knowledge do you wish to acquire when you go for your fellowship? You should write in such a way that you want to come back to your home country and serve and put those skills that you learn there into practice. These are the kind of answers that actually help you in getting the examination. This was my experience. I was an ICO fellowship in oculoplastics and oncology 7 years ago at the New York INR Infirmary. We were able to publish extensively during that time, and it was based on my ICO fellowship that I was inducted as a member of the American Society of Oculoplastics and Oncology. So to summarize, plan well, take all stakeholders, which means your family, your employers, and other friends whose advice you may actually be able to work on. Choose wisely so that you can build a career based on your ICO fellowship. Remember, it's not just a vacation. It can actually help building connections and improve the quality of your practice. At the end of the day, the ICO examination and the fellowship is definitely an asset. Thank you. If you have any questions, I'd be happy to take them